Greetings. Let us learn about colitis. Here is a healthy colon, and when you look at the transection of the colon, you have mucosa, submucosa, muscle, and serosa. In colitis, there is inflammation of the mucosa. And in ulcerative colitis, the inflammation is limited to the mucosa and it is continuous without any skip lesions. It starts in the rectum and extends up continuously. In contrast, when you look at Crohn's colitis, the inflammation is involving not only the mucosa but also the submucosa and extends through the wall. It is transmural inflammation. Unlike ulcerative colitis, in Crohn's colitis, the colitis is not necessarily contiguous. You could have skip lesions. So in ulcerative colitis, it is a mucosal disease and then extends from the rectum up continuously without skip lesions. In Crohn's colitis, it is transmural disease and it has a non-contiguous involvement not only of the colon but different sections of the GI tract, and it has skip areas of healthy looking segments of the GI tract. Colitis, that is inflammation of the colon, could be seen not only with ulcerative colitis and Crohn's colitis, but could also be seen with infections, otherwise known as infectious colitis. It could also be seen with ischemia, otherwise known as ischemic colitis. It could also be seen in patients who receive medications, that is drug-induced colitis. So now let us look at what a colitis looks like. And before we go there, let us figure out the extent of involvement of the colon in a patient with ulcerative colitis. We have learned that ulcerative colitis starts as proctitis, that is inflammation of the rectum, and it could go up and involve the not only the rectum but also the sigmoid colon, otherwise known as proctosigmoiditis, and then it can extend up to the left side of the colon, otherwise as known as left-sided colitis or distal colitis. And in severe cases or extensive disease, it can involve the entire colon, otherwise known as pancolitis. In patients with ulcerative colitis, sometimes the inflammation can also go up the last segment of the terminal ileum, that is otherwise known as pancolitis with backwash ileitis. So we've learned about the different distributions of ulcerative colitis: proctitis, proctosigmoiditis, distal colitis, pancolitis, pancolitis with backwash ileitis. Now let's go back to the healthy colon and let us see what do you see in patients with Crohn's colitis. Crohn's colitis typically present with inflammation of the terminal ileum and right-sided colon, otherwise known as ileocolonic Crohn's disease. So, rest of the colon looks good. And when you go to the right colon, you start seeing inflammation of the right colon, ileocecal valve, and also the terminal ileum. Sometimes in Crohn's may not involve the colon, but just involves the small bowel, in which case it is known as ileitis, or it could involve segments of the small bowel, otherwise known as jejunoileitis. And in some cases, it could be involving just the stomach and the duodenum, that is gastroduodenal Crohn's disease. You could also see patients where you have Crohn's involving small bowel segments and colon segments. And sometimes you could mistake whether it is ulcerative colitis or Crohn's if it just involves the rectum, that is Crohn's proctitis. So Crohn's disease, we have learned that it involves different segments of the GI tract with skip lesions, but the most common site is ileocolonic Crohn's disease. To understand a little more about Crohn's disease, let's go back to the healthy colon. You can see here the mucosa, submucosa, muscle, serosa. And with Crohn's colitis, there is transmural involvement of inflammation. The wall becomes thicker and inflamed. And there could be deep ulcers or fissuring ulcers. And if they go deep through and through the wall of the colon, it leads to fistula formation. And the fistulas can go out of the colon and get infected and create an abscess. So, unlike ulcerative colitis, which is purely mucosal disease, Crohn's disease can involve the entire depth of the wall of the colon or the transmural involvement with inflammation, deep fissures or deep fissure ulcers, fistulas, and fistulas get infected, abscesses. So with this background, let us look at what do you see when you perform endoscopy in patients with colitis. Here is a healthy colon, and how do you know whether it is healthy? You can see the haustral folds, and these are sharp folds. They are very sharp and not very thick. And you see shining mucosa and moist, and you see the blood vessels. And when there is inflammation of the mucosa becomes thicker, so the folds become thicker, and the vessels get obliterated, and the inflammation becomes more severe. You see, like a wound, a rough granular surface, and which is friable. That means it bleeds easily. And if it gets worse, you'll see deep ulcers. So let us look at a colitis picture. This is mild inflammation. As you can see, the folds are a little bit thicker, and the mucosa has become a little bit granular, and there are some erosions. All right. And if this inflammation becomes severe, you will see a lot more erosions with confluence. And if it becomes severe in ulcerative colitis, one of the things is the haustral folds are lost. The colon becomes a short, straight tube, like a tubular colon, and with a lot more inflammation, you can have extensive ulcerations. You could see this same picture in a patient with ulcerative colitis. You could see the same pictures with Crohn's colitis. You could see the same picture with infectious colitis as well as ischemic colitis. The segment that is inflamed looks the same. However, when you see skip lesions, you think deep ulcers, you can think about Crohn's. If you have segmental distribution, that means a particular area of the colon gets inflamed because of vessel supplying that area is not supplying blood flow like it should, then you can have inflammation of that segment. Then the rest of the colon looks okay. So these are the other features you think you take into consideration as you make the diagnosis. But otherwise, inflammation of the colon looks pretty much the same. However, when you see deep ulcers like this, or like this with areas that are spared, or when there is narrowing of the colon, then you think about Crohn's colitis, especially if you find skip lesions. As we move on, sometimes patients with diverticulitis or certain cancers undergo surgery and the colon contents are diverted into a bag, that is colostomy, and the rectum doesn't see the stool material. Colon depends on short chain fatty acids for their nourishment, butyric acid, etc. And when the rectum doesn't see the colon contents coming through because of diversion, the rectum tends to weep. It's otherwise known as diversion colitis of the rectum, and you can see inflammation. And this could be reverted if you reanastomose and let the contents go down the rectum. I hope this is useful. Thank you.